Welcome to the third episode of The Social Talk. Today we have a very interesting guest who is a smile designer, who is a dentist, and we have Dr. Sachin, who has experience of over 34 years in this field and who is the managing director for Bay Avenue Dental Clinic. Welcome, Dr. Sachin, to Social Talk.
Thank you, Naseef. I'm very glad to be here on this show.
I'm also really glad to be have you as our guest as well. We know each other for quite a while. What always got me interesting was you have Bay Avenue Dental Clinic in one of the prime location in Dubai, which is in Business Bay. How did you start Bay Avenue Dental Clinic?
Well, I came to Dubai way back in 2004. I came, and then I was working in a private clinic for some time, and then I decided that it's time to move and start my own clinic. So I was looking for a place, and some of my friends in real estate, they suggested that why don't you start in Business Bay. So it's because of them that I came to Business Bay. Also, I used to practice before in Oud Mita, and my wife used to practice in Oasis Center. So this was like a good halfway point so that the patients could come to our clinic. That was one of the deciding factors.
Okay. So I would say that is one of the bold decisions as an entrepreneur to take, right? To have it in a prime location at the beginning.
It was, yes. Yeah. Definitely it was. And when I started in 2014, Business Bay was not what it looks like today.
Okay.
It was an upcoming area with not so much of crowd, not so much of traffic, and not so many buildings. Quite a few buildings have come up in recent times. In fact, quite a few roads were also made later on. So at that time, it was a different scenario altogether. You can say it was a bold step because it was a new area and starting the venture was a challenge.
So as an entrepreneur and also as a dentist or orthodontist, how's your experience? How things are going for you? What do you prefer, an entrepreneur or as an orthodontist?
To be very frank, yes, I love to be a dentist or orthodontist. I have a passion for orthodontics. I love creating beautiful smile, and that will always remain my love. But after being in practice for 22 years, I thought I have to make the next move. I need to start something on my own. So yes, and I'm enjoying being an entrepreneur. It's a challenging job, new, fresh challenges on daily basis. Yeah, it's good, but.
So you just mentioned you create better smiles. So I wanted to just ask how oral health or a good smile actually bring confidence in individuals.
In the present day, the looks and the beauty is very important. The standards are very high. People expect to have a beautiful smile. When you go for a meeting or when you're doing a presentation, again, a beautiful smile does make a good impact. It is very essential. We do get a lot of patients, adult patients, for some reason maybe they have missed out getting an orthodontic treatment when they were young. But now they are aware of it and they want a beautiful smile. So yes, it does make a lot of difference. It gives you that confidence, and it gives you a confidence to go into public speaking and
to meet also other people as well, right?
Also, with the social media being so
important,
having a beautiful smile does
affects it a lot. I think is it also true that in Dubai it is a lot more than other places?
I would say yes. Dubai has always been a very fashion conscious society. As people from Dubai, we like to take things to the next level always. Yes. So yeah, Dubai is leading the way in this field also.
And when you mentioned as well, people who are adults, they have missed it when they were kids.
Yes.
So right now, the parents who are watching this, their kids might have crooked teeth or they don't have a really good smile. So what are the steps they should take in order for them to feel more comfortable and confident?
Many a times parents ask this question, what is the right age to start an orthodontic treatment or to consult a dentist? If you feel that the child is not having a good set of teeth, the ideal age would be 9 years for your first consultation. At that point of time, we do an examination and we assess if the patient is going to have any problems in the future. Many a times it happens that there is crowding of the teeth or there is spacing of the teeth. Some of the problems you can wait to be treated at a later date. But sometimes what happens is the proclination of the teeth may not be only because of the dentition, but
Okay.
it could be because of the bone structure.
Okay.
What I mean is there is a mismatch between your upper jaw and the lower jaw. Sometimes if the upper jaw is ahead, you'll find that the upper teeth are protruding more.
Okay.
Sometimes if the lower jaw is ahead, then you find that the patient has a reverse bite.
Okay.
Okay. Or if sometimes it could be a combination that the upper jaw is big, lower jaw is small, and then the gap between upper and lower teeth is quite big.
Okay.
So these type of problems where the jaws are involved, we like to treat these patients earlier on.
Okay. So before even 9 years.
Yes.
Okay.
Some of these cases can be treated earlier, before the age of 12. And we just see how the growth pattern is.
Okay.
And accordingly devise a treatment plan and advise the parents.
Okay. Okay. So parents doesn't have to be worried about like how kids will feel if they go for the treatment, because I think fear factor is there, right? Most of the times. That's the reason why parents are not coming.
Yes, there is a fear factor, but again, many a times, what nowadays we find that children who come to us, even at the age of 10 for that matter, they go onto the Google,
Okay.
they search, they try to find out what can be done, what should not be done.
Okay.
So when they come to us, they are very much aware
Okay.
of the treatment, of the problems they will face, or what outcomes they will see. So it's good that they are aware of it. Only thing is, it has to be balanced.
Okay.
Sometimes
It can't be too much as well.
Exactly.
They can't be the doctor. They can only
Yeah.
get some information.
It's good that they are aware of things when they come to us. Yes, it helps us. That makes my job easy.
Yeah.
Definitely. Second thing is, now I strongly feel that patients in general and children in particular need not be afraid of dentistry as such. We're trying to make it more and more patient friendly, avoid uncomfortable experiences, avoid pain, avoid discomfort. So they need not be afraid. Yeah.
Okay.
And if at all, like for example, we used to have problems with the fixed braces before on.
Okay.
So there is a very good alternative to that now.
Yeah.
We have aligners.
Yeah.
A lot of people are familiar with the brand Invisalign.
Yeah. Okay.
They are very comfortable.
People used to think that is the product name, but
Yeah,
they have done a good
it's
job.
a brand name actually.
Okay.
Generic name I would say is aligners, invisible aligners or clear aligners.
And that can be also used for adults, right?
Yes, of
Okay.
course. In fact, it gives very good results with adults.
Okay.
The advantages of using aligners, first of all, with the aligners, the amount of pressure that is put on the teeth is very low.
Okay.
So there is no pain, no discomfort. In fact, at times patients come and tell us, "Doctor, I didn't feel anything. Are you sure it's working?"
Okay.
Okay.
Yeah.
So that's one thing. Second thing, there are no restrictions about eating. Once you remove the aligner,
You can
it's
eat it.
as good as eating with your normal teeth.
Okay.
So you can enjoy your meals, you can have your good food, whatever you like, you can have it.
Yeah.
Also, brushing is very comfortable. Once you remove the aligners, it's same like brushing your natural teeth.
Okay.
So that's again very comfortable. And what research has shown that lower the pressure, faster the tooth movement.
Ah, okay.
So what happens is when we are using aligners, the pressure on the teeth is less.
Okay.
And the tooth movement is quite faster.
Okay.
So you may find that we ask patients to change the aligners every 2 weeks. So the activation is at a faster pace, and then that has reduced the treatment time.
Okay. So between aligners and what is the other thing called?
The fixed braces.
Between aligners and fixed braces, what is the time period like?
It again depends from case to case, depends on the severity of malocclusion,
Okay.
severity of the crowding our patient has, or the problem what patient presents with.
Okay.
But for example, if it's a moderate case which can be completed between 12 to 15 months with the help of fixed braces,
Okay.
The same case, if it is treated with aligners, it can be done in 7 to 8 months time.
Wow. Okay.
So
That's such a
that's-
big difference.
Yes,
Yeah, almost half the time.
half the time. Yeah,
Okay.
it definitely saves on the time. It's
Okay.
more comfortable, more acceptable to the patient,
Okay.
and patients I've seen are more happy with it.
Yeah. And also like nowadays, apart from like having this, people you also do veneers, right?
Right.
So I think that's also more costlier if I'm correct, or if not, correct me please.
Doing veneers has got its advantages, has got its disadvantages also.
Okay.
If it's a minor crowding or minor rotation of the teeth, yes, we can correct it by doing veneers.
Okay.
Yeah. However, if the crowding is more severe or the problem is more severe, we may not be able to do with veneers only.
Okay.
In those cases, we need to do some amount of tooth movement with the braces, with the aligners, and then go in for veneers. There are 2 or 3 different types of veneers that are available. Veneers, let me just explain to you what veneers is.
Yeah.
First of all, we remove a small portion of enamel from the surface of the tooth, around 0.5 millimeter or 0.5 to 1 millimeter enamel is removed,
Okay.
over which we make a veneer of ceramic and which is stuck onto the teeth. So that is what a veneer means. It's like a coating. It's something what we do.
Yeah. Okay. Extra material which we are
Which is
putting
stuck
on the.
over the tooth. Okay. Now the advantages, like you said, first of all, it is quite faster. Second, it's very low on maintenance. Third thing, you don't need frequent visits to a dentist for cleaning of the teeth,
Okay.
those things. And in the film industry or television industry, it is an advantage to the stars because then for them the continuity is not a problem. Previously,
okay.
what used to happen, you have done one shot where your teeth have stains, you go to a dentist, do the cleaning, and the second shot, the teeth are nice and clean.
Okay.
Or vice versa. That used to create a continuity problem.
Okay.
That can be solved with veneers.
Oh, I never thought of this angle.
Yes.
Okay.
Yeah.
And what are the disadvantages on veneer?
Like you mentioned, the ceramic veneers or the good quality veneers can be a little expensive.
Okay.
That's one thing. And yes, you need to be careful when you're eating. You have to avoid hard and sticky things
Okay.
throughout. Accidentally, if you bite onto something very hard, the veneer may come off, which is a disadvantage.
So you said you have 34 experience as an orthodontist. Do you think like people usually often come with any misconception about like oral health or
Yes, they do. And some things we have been trying for many years to change the perception or change the way people think.
okay.
To a large extent, we have been successful. We always tell the patients that the best treatment is preventive treatment. So as a dentist, we always tell patients that, you should have a regular checkup done. And the best thing to do is you get a cleaning done once in 6 months. First of all, yes, your teeth remain nice and clean.
Okay.
Your gums remain healthy. When we do the cleaning, we look for any problems which are just beginning.
So you
For
can-
example, if it's just a small cavity which is in the initial stages, a simple filling, if done at that point of time, can save you a lot of pain and money.
Okay. Yeah.
Yeah. That would be the best thing.
Okay.
Second thing in preventive, what we always tell patients is you should go in for fluoride applications if required.
Which means
Some patients, they have a tendency to have more number of cavities than normal. So that could be because of various reasons. It could be because of your diet. It could be because of the enamel of your teeth. Or it could be because of other habits. Some factors are in the hands of a patient.
okay.
Some factors are not. For example, we do find patients who have low salivary secretion.
Okay.
That means the amount of saliva that is produced in your mouth is less. This can cause increased cavities, but then you can't really blame the patient.
Yeah. Okay.
Or sometimes the consistency of saliva is so thick that in spite of doing their best, we do see more number of cavities in patients' mouth. So some of the factors, like I said, are not in the hands of patients.
But it's better to be checked earlier and then in the
so
later stage.
when such type of patients come to us, we do the checkup, we do the cleaning, And we tell them that, you need to do a regular checkup from time to time. And then, yes, we prevent the plaque formation, the tartar formation, gum diseases, cavities formation.
So ideally
these
6 months.
6 months, yeah.
Yeah, 6 months once you should go to a
6 months
dentist.
is the norm for a common individual.
Okay.
But some patients where we find that the amount of tartar generated is more, we can tell the patient you should do it once in 4 months also.
So
And like
prevention is better than
cure.
cure.
So like I was saying, if we find that a person has a high caries index, we advise them fluoride. It could be in different forms. The most common form, of course, is from your toothpaste.
Okay.
Always, always, always make it a point to use a toothpaste which contains fluoride.
Okay.
Very important, because I would rate that as a most important component in any toothpaste. That's number one. When the percentage of fluoride in the toothpaste also matters. We do get medicated fluoride toothpaste where the percentage of fluoride is higher. This is recommended for patients who have higher caries index.
So do you recommend any brand for that? So maybe like the people listening can buy it for the next time.
See, the thing is about toothpaste, the most important component is the fluoride.
Fluoride.
You can check for the fluoride content in the paste and choose a paste. I wouldn't recommend any particular brand as such, but check for a brand which has got
Fluoride in it. What is the percentage
fluoride.
usually?
2 ppm.
2 ppm.
Yeah, that is the percentage.
I want to ask a couple of things on your personal side. We have talked a lot about dentistry, orthodontics, and more technical side, how we can improve our oral health. So you have mentioned you like scuba diving, you like trekking, you like traveling and road trips. What was the most memorable experience you had with your experience on these?
I have been trekking since I was very young. From my school days, I've been trekking. We had a couple of times very memorable incidents, like you said. Long back, I was traveling in one of the jungles.
Okay.
And then we were told that, there was leopard sighted in this particular area previous day. So that really put a fear factor in our mind.
Okay.
So that was quite exciting.
And have you seen any leopard?
No, not during, but we could hear that.
Oh, okay.
We did
So
hear
it was
the roar.
close.
We didn't see it, but yes, we did hear the roar.
Okay. Where was
And
this? Where was this?
It was on a trek to Kanheri Caves
Okay.
on the outskirts of Mumbai.
Okay. Okay, great. Traveling is one of the interesting thing for me as well. So I can imagine how excited you were. When it comes to your personal life, your wife is also working or part of Bay Avenue Dental Clinic. Both of them together in one company or working together, how does it feel?
To be very frank with you, we have known each other from our college days.
Okay.
So you can say we are used to being together most of the time. And it is a very symbiotic relationship in the sense, when I need help, I know she is there to help me.
Okay.
At the same time, when she needs help, I'll definitely be there. Can share the responsibilities. It has been a lovely process. We've been married for 28 years now.
Wow, great.
And it's been a lovely journey.
Okay, great. And she is also a dentist and she takes care mostly kids.
Yes.
Right?
Yeah. Children's as well as she does a lot of root canal treatments and crown and bridge.
Can you also just tell us where you are located in Business Bay so that somebody who's watching it can come and visit your clinic?
Our clinic is located in Regal Tower, which is just opposite, you can say, JW Marriott Marquis Hotel. We are located on 17th floor, office 1701.
Okay.
Parking is available within the building, so that makes things a little easy.
Yeah.
Also, in our clinic, we have most of the insurances, so we can do direct billing with most of the insurances. And also, for patients' convenience, we have easy payment plan with ToothPay. So you can get a 4 to 6 months payment plan without having to pay any extra dime.
Oh, that's great. Okay.
0% interest.
Okay. Yeah, put it rightly. You have scanning facilities and everything there, right? So can you just also let us know what exactly they are and what kind of...
It's more than $20 billion industry worldwide and a lot of innovation happening. At times, it's difficult to keep up with the innovations. We try as much as possible to keep up with the innovations. The scanning has been with us for last 8 years now.
Okay.
You remember having taken the impressions with a clay-like thing, which could be uncomfortable for a patient.
Okay.
So those things are a thing of past.
Okay.
We don't do that anymore. We have an intraoral scanner. It's like a pen which we move all over your teeth and get a good three-dimensional image of your teeth and the gums. Being a digital image, it is very accurate. Number two, because it's a digital thing, it can be easily passed on to the labs nowadays.
Okay.
So this has cut down on the treatment time. Color matching has been made easy with the scanners.
Okay. One last questions before we end this episode. I usually argue with my friends and family. Is it electric brush or regular brush?
There is a conclusive evidence
Okay.
to prove that electric brush is far superior to manual brushing.
Okay.
When you're doing a manual brushing, you may miss out certain areas in your mouth, whereas when you're doing electric brushing, you don't tend to miss out. You follow a certain pattern so that you don't miss out any areas. Second thing is the rotations per minute
Okay.
are so precise that it gives the maximum cleaning. And third, of course, it has got something like a shock absorber mechanism, so you don't apply too much pressure on your teeth. One of the biggest problems with manual brushing was that people tend to apply too much of pressure, which can damage your gums, which can damage your teeth. So I'll definitely recommend that go for electric brushing.
Okay.
Try and avoid manual brushing.
One more question. As an entrepreneur who wish to start their own business or even can be a clinic or anything, do you have any tips or advice for them?
Yes. The most important, I would say, is take that leap of faith. When you're working and when you want to shift from being an employee to an entrepreneur, you have that in you, that fear in your mind, whether this will work. And I have seen quite a few of my friends thinking over it for a long time.
Yeah,
But believe me, all of them have said one thing to me, that Sachin, I should have taken your advice and started it before. Because it gives you a great amount of satisfaction. When you start your own clinic or your own business, nothing can beat that satisfaction.
I think we had a really good session, and I think the amount of information you gave us throughout this podcast session was great. And a lot of people who are watching this will also get helpful insights from this. And when you were talking and telling us about each and every details, to be honest, I had a very vague idea of certain things. Now I have better idea. So as a person, if I want to do something, I will have better insights, and decision making would be much more faster.
True.
So hopefully whoever is watching will also have the same amount of insights, and they also get a really great help, and also more people come to you and get great smile.
Thank you so much. Thank you, Naseef. It was a pleasure talking to you.
Same here. Thank you.